Listen, I got a word for y'all. Most of y'all do not need surgery, period. Let me get into who needs surgery and who doesn't. Welcome to Level the Playing Field. Let's get rolling. So here's something I want y'all to take home from this. It's a concept called the shared decision-making process. Shared decision-making process. What does that mean? Gone are the days where you walk into a doctor's office and they tell you, this is what we're doing, this is the plan, and walk out. That's done with. Shared decision-making means that you are in the driver's seat and we work together to come up with a plan. Now, as the physician, as the doctor, I have an expertise in this field that you're coming to see me about. If you injured your knee, I have an expertise in that. You injured your hip, I'm an expert in that. So I know the anatomy of the hip and the knee. I know the data and the research related to return to sport and injuries. I know the best course of action when it comes to, the surgical side of things technically. Just because I know that doesn't mean it's best for you. We have to come to a decision together based on what you need and what your goals are. That's that shared decision-making process. So how do we decide? Well, like I said at the beginning, most of y'all don't need surgery. Most orthopedic ailments can be treated with conservative treatment. What's that? Physical therapy, ice, rest, take your time, give it time, patience. All these things are really what most people need, even for what we call severe injuries. I'll give you an example. So if you're looking at the knee, the MCL, that's the medial collateral ligament. Medial collateral ligament is an important stabilizer to your knee. It also has a remarkable ability to heal itself. So most people with MCL, medial collateral ligament injuries, do not need surgery, even if it's torn. They need time, maybe a brace, possibly physical therapy, and then we keep it pushing. And that's pretty much it for the majority of y'all. So how do we decide if you need to have surgery? If your injury is such that it threatens the way you're going to move for the rest of your life, well, that's a no-brainer. If you break your tibia, your shin bone, in a lot of cases, depending on how bad the break is, how much it's angulated, how much it's displaced, that's going to be a surgery for someone who walks around on a daily basis, okay? Because you're not going to be able to do that unless your tibia heals properly, your shin bone. So that's a no-brainer. That's off the table, easy, okay? If it's life-threatening, not a lot of that in orthopedics, but it can happen, then certainly. If it's limb-threatening, like you may lose a limb because of this, no-brainer, doing surgery. Let's go into the middle of things. Things get a little bit more gray though, okay? All the way on the other side, things that never need surgery, right? You never need surgery because you have almost never need surgery for patella tendonitis, jumper's knee, almost never. I'll never say never, all right? But somewhere in the middle is that gray area. The ACL is one gray area. So a lot of y'all think I tore my ACL, have to have surgery. Not always. In fact, for a lot of people, that may not be the case. So the ACL, we talked about this before, anterior cruciate ligament, and it is key for stabilizing the knee when you're doing cutting or pivoting activities, suddenly changing directions. Competitive sports that involve that kind of thing are like soccer, basketball, football, lacrosse, tennis, it goes on, right? But just because you tear it doesn't mean you have to have it surgically fixed, reconstructed that is. So let's say you live a life that does not necessarily require you to cut and pivot a lot. You could even be a marathoner, a high-level athlete. But if your knee is not giving way and unstable to you, and you don't need to cut and pivot, and you can rehab and get the knee strong enough that having that ACL tear doesn't bother you, you can go on about your business. That's it, the end. So just because you tore an ACL doesn't mean you have to have surgery on an ACL. And that's why the shared decision-making process is so important. Because you and I need to talk about what are your functional goals? What do you need to get out of this knee? If it's, well, I just need to take walks in the evening, right, to keep my cardiovascular health up. I want to do some strength training. I want to work out in the pool. An ACL may not be the surgery for you. Now, if it's, I'm going to play high-level sports, basketball, football, in really most cases, that's going to be the case. Now, even then, there's some gray area, but for the most part, a full ACL tear, if you're going to be playing high-level competitive sports, is going to be something we're going to at least have a serious conversation about. But we don't need to rush in our mindset that we have to intervene and do surgery on everything that happens to us. Surgery needs to be thought of as a last resort. If there's no other way for us to get to the desired outcome, that's when we do surgery, and only then. So if we go back to the tibia break example that I used, you break your shin bone, your tibia, there is usually no other way for you to get back to walking around daily if you break your shin bone. That's it. We got to fix it. And that's where we make the decision. And the decision, excuse me, is a little bit less complex then. But when you're in that gray area where you could go either way, where things could get better without you having to do surgery, that's where we have to talk. And that's where we have to talk about your goals and your function. So that's a two-way street. So one thing that I can't stand when someone tells me, I don't know, you're the doctor. Well, no, it doesn't work that way anymore. That's done. You talk to me and I talk to you. You're the expert on your body. You know yourself better than anybody else in this world. You know what your goals are. You know what your needs are. You know what gives you life. You know what movement makes you feel whole. You got to tell me that. Then I can tell you, well, I know based off what I know about ACL injuries, for example. I know based off of that thing you're talking about, maybe we don't have to do surgery. Or maybe we can see how you do with some rehab and maybe surgery's not even needed. Or I could say, hey, look, you want to do this high level thing. With an ACL tear, I don't see that going as well. Maybe we should have this talk about doing surgery. It's a two-way street, shared decision-making process. Take that home, Google it, make it part of your vocabulary. Next time you see the doctor, make sure you make that part of how you discuss it with them. Welcome back to Level the Playing Field. We'll see you next time.